Welcome to the Pharmacists Are In, a podcast made for pharmacists by pharmacists. Pull up a seat and let's get started.
Well, welcome back, everyone, to another episode of the Pharmacists Are In podcast. My name is Ajit Johal. I'm a pharmacist from Vancouver, British Columbia, and I'm joined by my eloquent co-host, Dr. John Papastergiou. How are you, John?
Good, buddy. Good, but I feel like it's been a while since we've been on air, and I haven't seen you in a while as well. How are things? I mean, it's a lot going on in the profession. We haven't really had a chance to chat.
Yeah, it has been a while since our last episode. I believe the last one dropped in February when it was still cold. And now it's the summertime. And yeah, a lot's been happening, John. I think there's a lot we can update our audience on things we've been up to. One of the big things I wanted to chat about today was my recent presentation, my abstract presentation at the International Society of Travel Medicine Congress in New Orleans, which highlighted the role of pharmacists in providing pharmacy-based travel clinics. So the abstract really highlighted the number of vaccines we did, the number of patients we saw, both pre and post-pandemic. And people were very surprised, not only at the volume, but the quality of the service. So one thing that came up in the conference was especially low middle income countries are seeing a lot of international travel. So there's certainly an opportunity to mobilize better access to pre-travel care in these countries. And even in Canada, John, I think there's a lot of interest in travel medicine, as you know.
Oh, absolutely. I know in our pharmacies now we've got travel clinics in place almost across our entire network. I think pharmacy as a whole is waking up to that. This could potentially be an awesome business opportunity, revenue generating for pharmacists, but it meets a need. Like the patients don't have a great understanding of what they need. And I think you and I have talked about this in the past. They don't even, especially with adult vaccination, patients don't even have a good idea of what they've been vaccinated for. It's very different than the pediatric space, right? So there's this lack of information, and the patients are constantly, reaching out to pharmacists.
Yeah, they are totally. And you bring up a good point, because one thing that international travel does is it prompts someone to actually look at their records, because not only are, they're potentially at risk for endemic diseases, for example, they might not be up to date. And we've talked about this in previous episodes with things like RSV and pneumococcal. Shingles is another big one. But as soon as they are traveling to a potentially developing country, that kind of puts up their spidey sense to kind of say, maybe I should have my vaccination records looked at it. So it's a really good opportunity, I think, for pharmacies to engage their current patients and actually provide a broader service to the community, because there's a lot of immunization gaps you're going to see in a pre-travel consult. And actually, in our ISTM presentation, actually the top do you know what the top 3 vaccines we gave in our clinic were?
I would say hepatitis, maybe, oh man, I don't know, would it be COVID? And I don't think influenza, but I'd say those 3.
Good guess. 1 out of 3 you were there. So hepatitis A was number 3 because that one is a food and waterborne illness. So anybody leaving North America, it could potentially be at risk for hepatitis A. They got to eat, they got to drink. It's even in ice cubes as well. And it's an immunization gap, because for most people, they don't provide it routinely. So there's this few special populations in BC. Aboriginal children on reserves get offered this vaccine, but in the school-based program, it's Hep B. Depending on where you are in the country, you get that in your routine schedule, but you don't get Hep A, which is food and waterborne. So that's definitely a key immunization gap. But the other 2 were tetanus, diphtheria. So tetanus.
Oh yeah, shit.
So many people are not up to do their tetanus shots. So
yeah,
And diphtheria is endemic in developing countries. So it's certainly something that we should update our patients on. And then the other one is measles, mumps, rubella, right? So measles, of course, unfortunately, with low vaccination rates, especially post-pandemic, huge resurgence. And how do we get these outbreaks? A lot of time it's imported from travelers. So really important. And actually had a few Ontario pharmacists come up who were ISTM certified and said, we don't have access to these vaccines, like publicly funded Tdap or tetanus, diphtheria, and MMR, which I hope that changes, to be honest.
Well, I don't know if you saw, I made the health section of the Toronto Star talking about this.
I did see it. Yeah,
Did you see that? Yeah, it was, and I got a lot of media outreach after that article, and we spoke exactly about that. Is the access to publicly funded vaccines in Ontario is a huge problem. So really, when you think of publicly funded, and this is why probably COVID and influenza made my list, because that, those are the only two publicly funded vaccines that we have available in pharmacies. Everything else is either private, third party pay, or you kind of refer them off. And it's when you talk about the real value from a pharmacist perspective, is the accessibility and convenience. And if you don't have access to those public vaccines, you take away those two big drivers of what people want to find and want to see in community pharmacy. So I don't know why we haven't had a lot of traction in that yet. I think there's a movement to continue to push for that, but it seems like we're still at a standstill now. And with everything provincially going on, I think with tariffs and everything else, it seems like some of these the movement towards expanded scope or more scope in pharmacies has kind of almost been delayed a little bit. So we'll see what happens with it all. I know Ontario Pharmacists Association is really pushing some of those mandates. But I wanted to ask you, being in New Orleans, like, was it an international audience, or did you have a lot of Americans? I'm always interested to see what the perspective is of the American pharmacists, because I found there was a time where we were kind of neck and neck with respect to scope, but over the last few years, I think we've really pushed ahead of the Americans. And what was your perception there? Did you make any observations?
Oh yeah, definitely. I'm glad you asked the question. So first of all, the Congress was booked in New Orleans before everything happened with the new administration. So there was quite a bit of attrition, especially from Canadian delegates, due to the geopolitical tensions that have manifested since early 2025. So that was interesting. All of the American attendees were either physicians, nurses, or physician assistants. So there weren't a lot of pharmacists. And what the American attendees did say is they said, yeah, we know Canada that pharmacists can actually run a full service travel clinic, which is something we can do, especially in Western Canada. So BC and Alberta with our scope. Saskatchewan as well. They've got a pretty good scope based on some additional training. And Ontario as well, with medical directives, a pharmacist can run their full suit travel clinic. So I would agree with you that Canada really leads the way when it comes to providing advanced immunization services. So that seemed to be a trend when I talked to the American attendees, that they were very well aware that what we can do as pharmacists in Canada, and it was very normalized. They say, oh yeah, you're a Canadian pharmacist, you can do all this stuff. Like, that's what they do. And it doesn't quite translate in the US right now. Various states have different regulations, and it's just not quite as set up. They haven't quite taken it to the level that we've taken it at this time.
Yeah, it seems like for retail pharmacy in particular in the US is under a lot of flux. I mean, there's a ton of changes going on there. I'm sure you heard about, CVS, Walgreens are scaling back on their store locations and everything else. So I wonder if that's impacting where they're going with scope, right? I think it's probably a lot of this stuff's in many cases driven by the big retail chains in the US, and I think they've had a lot of issues, right?
Yeah, no, totally. And I think the other thing is, a lot of the countries pharmacists look to us in Canada as leaders, especially in immunization. So just going to immunization as a broad sort of clinical discipline. Canada leads the way, and we both interacted with FIP, so the International Pharmacy Group, and presenting another abstract there in Denmark. Hope to see you there. And if you are there, we'll record some sessions.
Absolutely.
But again, illustrating not just scope of practice, but actually implementation. I think that's what I think the big interest is we're looking at over 100,000 antigens delivered in a 5 to 6 year period, of which 10% of them are these sort of recommended, potentially unfunded vaccines, whether it's travel, whether it's things like recombinant zoster for shingles, adult HPV. So flu and COVID make up a huge chunk of it. I think we've talked about this before, where any country or jurisdiction that wants to mobilize their pharmacists, flu is a great place to start, is it not? It's just a constant seasonal cadence that gets everyone in a rhythm, and then you can start building that confidence and adding other antigens.
Yeah, that was my message at FIP last year in South Africa. I spoke on the topic, and I said it always starts with flu. If pharmacists do a good job with that, the public responds and then demands more, and that's how you build these programs in pharmacy. It's the low-hanging fruit, flu, and a lot of the discussion is exactly that. How do you implement it in pharmacy? How do you change that mindset from dispensing to allow you to offer these services sustainably? And it's always a challenge for pharmacies that are just starting. Okay, how do I do that? How do I make the investment? Where is the reimbursement coming? And there's no, cookie cutter approach to that. It's really, making the right decision for your pharmacy, And I think, I don't want to change directions, but I wanted to ask you if, what happened in Alberta? It looks like they're pulling COVID vaccines or funding for COVID vaccines right now. And I don't know a lot about that, but I thought I'd ask you before we continue on our discussion with travel.
Yeah. So from what I gather, being in BC, is they are trying to minimize wastage of COVID-19 vaccines. So they are restricting access to them, essentially. And one of those ways they're restricting access is by not offering them in pharmacies, which, it's interesting because if you want to make a vaccine accessible, you put it in a pharmacy. So it kind of makes sense they're doing that. If they want to restrict access to a vaccine and make it harder to access, put them all back into public health units, right? Like we're saying.
Yeah.
So it's really obvious there. And the second thing is they're actually charging people for COVID shots.
Yes.
I'm not sure exactly who, what the cost is or who has to pay, but from what it looks like, when you look at the NACI recommendations, they didn't follow it verbatim. So they're kind of giving the high risk groups, the long-term care, the elderly, comorbidities, chronic medical conditions, access to publicly funded vaccine. But I believe healthcare workers or those providing essential services are also on NACI's list. I always get my updated COVID-19 vaccine. I don't hit any of the age or comorbidity risk factors, but there's a high degree of exposure for me to the virus, right? Being a frontline worker. So the problem is if you're going to charge your frontline workers, you're kind of digging them in both ends, because if you recall, Alberta had the highest ICU bed occupation with COVID. So if their vaccination rates continue to drop, which I expect they will, by restricting access to updated immunization, then healthcare workers are really going to be upset, because not only are they going to be potentially exposed to patients coming in, but they have to pay for their own vaccine. It's quite bizarre. I don't know how it's all going to play out, but wow.
Yeah, it seems like one of those things now we're changing the message to the patients. We really made so much effort to make community pharmacies the destination, and particularly in Alberta, where their scope is so advanced. I just find that an odd decision to pull them out of the community pharmacies once you've educated patients. Hey, this is where you go, right? It's almost like you're reversing course a little bit. But I know it was good to get your insight on that. But to flip back to travel, and this is the question I get asked. So I mean, I consider you an expert in this space, obviously. In Canada, if you've got one or two of these kind of therapeutic pearls or messages for a community pharmacist that's looking to implement a travel vaccination into their practice, you know, not to put you on the spot, but this is the point of the podcast. What would you say to them? You know, I didn't prepare you for this, but
Well,
you know,
I'm
what are
actually,
those points?
yeah, no, I've been wanting to talk about this for the past 14 minutes, John. So I'm glad you,
Yeah.
you asked the question. Well, I think the first thing is um, providing travel medicine service is not a box ticking exercise, it's a professional service. So, unless you're committed to investing in yourself in terms of knowledge and competency and your pharmacy to provide the service full stop, um, there's no point in dabbling in it, right? It's, we look at somebody coming in, if they have a complex itinerary, they're going to need all sorts of different immunizations based on their risk. It's with ChatGPT and all of these sort of AI entities, it's very easy to get information on what the recommended list would be, but it's that interaction you have with the patient where they trust you in shared clinical decision making that ultimately ends up what are the best vaccine for this patient based on the subtleties of their itinerary. So my first advice is if you're going to offer the service, commit to it, because I think there's no halfway. And actually, what we see is the Humpty Dumpty travel consult. What's the Humpty Dumpty travel consult? Well, we'll have patients go see a provider. I won't necessarily say it's a pharmacist, but it's a provider who went halfway, didn't provide the patient everything, i.e., they couldn't offer yellow fever, their site wasn't designated, they couldn't give them antimalarials because they didn't have prescribing authority or things in place, or they didn't have certain vaccines like rabies, Japanese encephalitis, or chikungunya. And then they go to another provider to kind of spend more time to kind of, undo and give the right information, and the patient pays twice. So the patient is really upset. They're like, well, why did I seek this service in the first place? And then both providers, kind of don't have a great experience. So I think that's the first thing, is if you're going to do it, go full tilt. The second is, well, Ajit, you're saying that I have to invest this time and effort and blah, blah, blah. Why should I do this in the first place? Well, John, when I started travel medicine back in 2012, when it comes to a business decision, it was a very offensive decision. So this was a way to kind of differentiate yourself, offer a service that no one else was offering, etc. Now, when we're in 2025, it's a defensive decision. So if you're not offering this service, then you could lose your patient somewhere else. And I think you're seeing this, right? It's like quality clinical services are not just something that are a nice to have, they're a have to have. And especially with everything that's happening in terms of compensation and everything with dispensing, and you've talked about it before with automation and things like that, is this becomes a way to not just elevate your business, but to fortify it. So I think there's more than enough travelers to go around to seek pre-travel advice. Most people don't because it's often not accessible. But having more quality providers, it can only boost public health and also the profession. So those are my real top two. After that, it gets a little bit more granular in terms of operationalizing it, but start there. And competency there is a standardization. So International Society of Travel Medicine offers a certificate through an exam, and by preparing for that exam and studying for it, you're kind of taking that step to really make sure that you know your stuff.
Oh, and that's all great advice here. And I can't tell you, you know, as you were speaking, it popped into my head how many times I've had a patient that's not my regular patient, comes in because they've Googled, knows we have offer travel vaccination services, comes into my pharmacy, books an appointment online, sees the pharmacist, and then transfers all their scripts after. You know, and it hits on your point that if you want to be competitive in general with community pharmacies nowadays, you've got to start offering these services. Otherwise, you'll lose your patients to pharmacies that do that because they go in and say, hey, my pharmacy doesn't offer this service. This was really cool. I'm just going to move everything here. And then you start telling them about all the other things. Hey, yeah, we offer point of care, you know, all the other things that you offer within the gamut of the possible services. I mean, it's a real differentiator. But nowadays, like you said, it's becoming routine, and you've got to be able to compete. To those pharmacists that don't want to necessarily do a formal course, like a course that's as involved as the international travel medicine course, what advice do you have for them, right? Like, because I think there's other ways to do it as well.
I think so. I think setting realistic expectations for yourself and your patient. As pharmacists, we're very good at triaging, right? For example, minor ailments is a triage exercise, knowing when you can provide something and when you should refer and what red flags to look for. So I think understanding what a complex itinerary looks like versus a simple one is key. So understanding what you can handle and what you can't. And I think this is where, and I've talked about this before, we need to be more intra-referral. Medicine does this so well, where they're so collegial. So-and-so will say, thank you for taking the time to see my patient, then refer them to a respirologist if there's a lung issue. Instead of telling patients to go see a travel clinic, they should be having a pharmacy clinic that they know in their community where they can send their patients to. Because the problem when they go to a travel clinic is often the wait times are quite long, and the access is a lot better. So I think we need to be more collegial and work together as a profession and understand which patients we can handle if we don't go the full length, and which ones we can't. And what I tell bigger pharmacies is if you have one person who's certified in your organization, it's more than sufficient to book around their hours, I would say. It's still more accessible, I would say, than a travel clinic, because that pharmacist is there doing other stuff. You block off, a couple hours of their time. You book all the assistants, book all the appointments in that time. So it doesn't have to be everybody. Everyone should be aware of it, but there's always, you can invest in one person being that sort of expert. And a lot of times, it can be a new grad, right? The new grads often are a bit more keen to take on new knowledge. I mean, they just finished their exams. You might as well just, keep the information going while the brain's still processing. So a lot of options. And you being from Shoppers as well, I'm sure there's some Shoppers stores that are more into it than others. And I think letting even within the network know that who are the ones who have certified people, et cetera, to make sure patients and providers get the best experience.
Yeah, I'm offering strep testing through a medical directive now. The rules have changed in Ontario a little bit, but my colleagues have been great at sending people to me. So one of the stores that does it, there's only a handful of us in Ontario, but we've got a great program around it. But yeah, I mean, that's what they're doing. Hey, patient comes in, asks about sore throat or whatever. If you don't mind going to, Coxwell and Danforth, they're offering the program. They've got a directive. We've got the technology in place, and it's been super successful. And I think it'll continue to grow as we get into kind of strep throat season with back to school. But no, those are all great points. I think we're going to continue to see this space grow, and I think we could probably do a number of episodes, talking about specific therapeutic areas when you get into travel, right? It's such a broad space, right?
Well, one thing I've gotten a lot of feedback on, John, which I think lends itself to a medium like this podcast, is those who are interested in getting clinical updates in travel medicine, or even if they're studying for the ISTM exam, is people often don't have a lot of time to sit there and read stuff. You don't have the time, I don't have the time, but we're driving, right? We're driving. So one thing that would work really well for pharmacists is an episode where it's dedicated to a specific clinical topic. We could do an episode on chikungunya. We could do an episode on cholera. We could do an episode on rabies. Yeah. There's so many different things that basically pharmacists can listen to, and not only just theory, but actually theory to practice from a pharmacy lens, especially with our experience operationalizing this and knowing the area. Huge. The knowledge translation and the convenience to this is unprecedented. So huge.
Yeah, we started doing yellow fever even. Like we're able to do that now, and there's a special process for that. So that's a great idea. And to the audience, if you want to drop some ideas in our chat, do that. Underneath the posts here, and we can start to shape some of these future episodes. But I think we're getting a little long on time, so it's always awesome to get to talk to you. I know we haven't had as much time over the last few months, but we're going to try to push some of these forward over the next little while and hopefully get our audience some additional segments, because I know we get a lot of positive feedback and it seems to be a good medium to pass on information. So great to see you, buddy. Let's plan some of these future episodes, and I'll talk to you soon.
Awesome, John. Always a pleasure. Looking forward to it. Take care.
Take care.